What are common myths about female anatomy? What are some common myths about female anatomy that many people still believe today? Let's take a closer look at these misconceptions and set the record straight. One of the most widespread myths is the confusion between the terms vagina and vulva. Many people think that vagina refers to all female genitalia. In reality, the vagina is the internal canal leading to the cervix, while the vulva includes all external structures like the labia and clitoris. This misunderstanding can limit how women discuss their bodies and health. Another myth is that the clitoris is just a small external bump. In fact, the clitoris is a much larger organ that extends internally, shaped like a double wishbone. It plays a vital role in female sexual pleasure, yet its complexity has often been overlooked in history. This reflects broader cultural attitudes toward female sexuality that have minimized women's experiences. Many believe that childbirth permanently stretches the vagina. However, the vaginal canal is elastic and typically returns to its pre-birth size after recovery. In some cases, if stitches are needed, the vaginal opening may even be smaller afterward. This natural elasticity is part of how women's bodies are designed. Another common myth is that women have smaller bladders than men. While body sizes differ, studies show that men and women generally have bladders of similar size. Differences in urination patterns are more about the position of the bladder and surrounding organs than capacity. People often assume that symptoms like itching or burning mean a yeast infection. However, various conditions can cause these symptoms, such as bacterial vaginosis or trichomoniasis. Proper diagnosis by a healthcare provider is essential for effective treatment. Some old myths suggest that higher education or physical activity can harm female reproductive organs. These ideas stem from outdated beliefs that portrayed women as fragile. Modern science shows no link between education or normal activities and harm to female anatomy. Another outdated myth is that the uterus can wander freely inside the body. This idea, known as the wandering womb, was used to explain women's health issues without scientific backing. Lastly, while mammograms are important for breast health, they do not detect all types of breast cancer. Additional imaging, like ultrasounds, may be necessary for thorough evaluation. Understanding these myths is important for reclaiming accurate knowledge about female anatomy. By recognizing how misinformation has shaped perceptions, we can encourage informed conversations about women's health and sexuality. This knowledge supports empowerment and better care for women everywhere.